Good morning. Welcome everyone to La Rabida Children's Hospital. My name is Dr. Kelly Guglielmi, and I am the interim CEO here at La Rabida. It is an honor to host Governor Pritzker and all of you for this important moment in sickle cell history. Effective management of sickle cell disease requires a comprehensive and a multidisciplinary approach, such as regular checkups with their primary care physician as well as specialists, access to effective pain management, medical therapies, and blood transfusions. La Rabida is a leading expert in treating pediatric sickle cell disease with one of the largest sickle cell programs in Illinois. We work closely with the Illinois Department of Public Health to assure that each child with a new diagnosis of sickle cell disease has access to the care they need. The lifetime cost of managing sickle cell disease is substantial and can be overwhelming for a family with limited resources. Hence, we are tremendously grateful that Governor Pritzker is taking definitive steps towards a sustainable solution to ensure equitable access to newer sickle cell disease therapies and other high-cost medications in Illinois. Governor, on behalf of the clinicians and the patients here at La Rabida and throughout Illinois, we thank you. It is now my honor to present to you Governor J.B. Pritzker.
Well, good morning, everyone. Thank you so much to Dr. Guglielmi for that very kind introduction, for your leadership here, for welcoming us to La Rabida. And I have to say it's great to be back here at La Rabida. I've had the opportunity to come and visit often during the holidays just to visit some of the young people who are patients here. The spirit here at this hospital is phenomenal. The young people, the children that are patients here, you can tell that they feel the spirit of positivity that comes from everyone that works here at La Rabida, and of course the great care that they get shows in the success that this hospital has had. So once again, thank you. I want to also acknowledge the great health advocates that are sitting around me. Behind me, our great Lieutenant Governor Juliana Stratton, our Department of Healthcare and Family Services Director Lizzie Whitehorn, Dr. James LaBelle from the University of Chicago, Dr. Radhika Pedenti from La Rabida, Assistant Majority Leader Camille Lilly, and Assistant Majority Leader Maddie Hunter, who I get to work with in Springfield all the time. And none of the good things that we get done really happen without their leadership. And I want to thank them for being here and also for being partners in healthcare delivery for the people of the state of Illinois. And Akiko Jenkins, who we'll hear from shortly, along with her daughter, Kyoko, who's a patient here at La Rabida. Thank you for joining us and for sharing your story today. I believe everyone deserves quality health care. And when I see an opportunity to make that possible, I work with healthcare providers and advocates to try to make that happen. We've entered an era today where modern science is starting to produce seemingly miraculous treatments and cures for conditions that have long been intractable and untreatable. We're seeing unbelievable progress in the medical field in record time. But fairness demands that as progress is made, we do everything in our power to make those treatments and cures accessible to everyone. Historically, we've seen breakthrough treatments end up out of reach for everyday Americans, strictly because of their cost. Well, gene and cell therapies could be no different than that if we don't address the problem right now in the early days. Sickle cell disease is an inherited blood disorder that disproportionately impacts people of color, particularly Black Americans. In Illinois, more than 5,000 people have this debilitating and life-threatening condition, and they're saddled with tens of thousands of dollars each year, often more, in out-of-pocket medical expenses while fighting for their lives. Well, Though the cause of sickle cell disease has been known for nearly 70 years, funding for research has too often been neglected and overlooked by foundations and governments. So progress toward a cure has been hindered until now. 3 months ago, the FDA approved the first 2 gene therapy treatments and potential cures for sickle cell disease. Groundbreaking progress that is bringing hope and opportunity for many, many families and patients. But once again, the cost of treatment, over $2 million, leaves it inaccessible to the vast majority of those who are suffering. Gene and cell therapies are rapidly being developed for other debilitating diseases too, and each one will likely present the same cost challenges. Here in Illinois, that's not going to stop us from trying to make these treatments affordable for everyone. So today, by executive order, I'm creating an advisory council to leverage the knowledge of national and state experts, healthcare providers, and disease advocates to find innovative and sustainable solutions for Illinois families to access these cures, starting with a focus on sickle cell therapies. We'll be working with the federal government, which has a similar effort through CMS to solve for these challenges. My goal is to make emerging and transformative gene and cell therapy treatments affordable and available for all Illinoisans who need them. If we can narrow the affordability gap, those who are suffering from these diseases won't have to wait a generation before they can access these groundbreaking cures. Indeed, I hope they won't have to wait more than a year. Our Department of Healthcare and Family Services will be leading the state's effort to discover and establish payment models and financing structures within Illinois' Medicaid program, which covers between 50 and 60% of sickle cell disease patients. HFS and the Advisory Council will explore options that consider the needs and financial capacities of everyday Illinoisans with sickle cell disease. And our new Advisory Council will seek out input and ideas from healthcare finance experts, providers, insurance companies, drug manufacturers, and Medicaid patients and families themselves. Today, we're taking a big first step to make these new groundbreaking gene and cell therapy treatments and cures available, with sickle cell disease at the front of the line. And by doing so, we're making it clear, access to new, innovative, and life-saving cures should be available to all Illinoisans, regardless of their income. With that, I am very pleased to introduce my partner in governance, the best lieutenant governor in the entire country, Juliana Stratton.
Hello, everyone. I'm Lieutenant Governor Juliana Stratton, she, her pronouns. Thank you, Governor Pritzker, for that warm introduction. Every day, I am reminded of how lucky the people of Illinois are to have you as a leader, and today is no exception. In the interest of time, I will echo the governor's thanks to every advocate, healthcare provider, elected official, and community supporter who has joined us today. Imagine that you or someone you love is struggling with a life-changing diagnosis. Maybe you've welcomed a new child who is now receiving a sickle cell disease diagnosis. Suddenly, the future that you envisioned is different. Now imagine in the midst of considering treatment plans, you come to find out that gene and cell therapies exist. Not only do they exist, they're getting approved by the FDA and headed to providers. You see headlines celebrating the readiness of sickle cell disease treatments and speculating whether therapy for cancers or inherited diseases will be next. But just as you start to sigh with relief, you're told that the cost of the treatment you need will exceed $1 million. It could even climb higher than $2 million. To access the hope and healing of gene therapy, your family will have to fork over more money than most people have seen in their whole life. That's what's happening for sickle cell disease patients today, and what will continue to happen as genetic therapies advance. Then consider that many of the diseases that could be treated, like sickle cell disease, glaucoma, disproportionately impact BIPOC people, especially Black communities. In fact, particularly when it comes to sickle cell disease, the inequities start to pile up. Disproportionate diagnoses, a wage gap between BIPOC and white Americans, generational trauma in the medical field. These harmful cycles keep Black and brown people sick, struggling financially, and feeling defeated. But today, Illinois says no more. We are done being teased with promising innovations only to have that relief ripped away or replaced with crushing financial stress. These gene therapies exist for a reason, to change and save lives, and that is something to celebrate. At the same time, the governor's executive order keeps equity right at the center, with the understanding that these therapies should not be out of reach for the people who need them the most. Today, we're taking steps to remove the financial barriers that stop Illinoisans from enjoying the progress our scientific community has worked so hard to deliver. I'm proud to be a part of an administration that works day in and day out to connect people with the resources they need to live a vibrant life. Thank you, Governor Pritzker, for signing this executive order and furthering Illinois' path to healing. With that, I'll pass it over to Director of the Illinois Department of Healthcare and Family Services, Lizzie Whitehorn. Thank you.
Good morning, everyone. I want to thank Governor Pritzker and Lieutenant Governor Stratton for their leadership. Thank you to La Rabida for hosting this exciting event today. I'm so glad to be here with all of you, including the doctors, nurses, caregivers, and parents who treat and advocate for your patients and your children every day. It is my privilege to serve as Director of the Department of Healthcare and Family Services, the state's Medicaid agency. At HFS, we are committed to expanding access to high-quality and affordable health care, to fulfilling the promise that health care is a right, not a privilege. This is what drives all of our work. In practice, this means that we must ensure that our customers, low-income residents of Illinois, many of whom are members of communities that have been marginalized in our healthcare system, have the benefit of the latest innovations in science and medicine. I can't think of a better way to do that than for HFS to take the lead in fulfilling the governor's call to develop options for financing new cell and gene therapies and other innovative drugs and treatments as outlined in the executive order that he will sign today. This effort got kick-started with the announcement that the U.S. Food and Drug Administration approved 2 novel gene therapies for sickle cell disease, a disease that disproportionately impacts African Americans. In Illinois, more than 40% of those diagnosed with sickle cell disease are enrolled in Medicaid, and nearly half of those Medicaid customers face a severe form of the disease. With these new treatments, we have the opportunity to vastly improve lives. I recently met with a group of doctors and nurses who serve those suffering from sickle cell disease, both children and adults. Some of you are here today with us. Thank you so much for your commitment to your patients and their families and for sharing your insights. They told me about patients who they have treated for years, some for decades, who watch with fear as they see other patients they know suffer and decline from this disease. They shared their patients' experiences facing discrimination and schoolyard bullying because of misunderstandings about sickle cell disease, of lost jobs and opportunities, along with the physical pain and symptoms. But now, finally, there is cause for hope and even excitement as patients and family members learn about these new treatments that can dramatically improve outcomes. They use terms like game-changing and transformative. They also talked about the smart investment it is for states to find a way to cover the cost of these treatments. They see firsthand the high cost of a lifetime's worth of treatment, on average up to $2 million in healthcare expenses and up to $4 to $6 million for the most severe cases, as compared to the current cost of almost $2 or $3 million for gene therapies. Therapies for sickle cell disease are only the start. As we speak, hopeful new treatments, gene therapies, and drugs are being developed for debilitating diseases like hemophilia and other rare diseases for which there are few options right now. With the governor's executive order, HFS will start building a bridge to link those in need with treatments that have the potential to alleviate their pain and symptoms and tremendously improve their quality of life. We will work with experts on a newly formed advisory council to develop innovative approaches for sustainable payment models with a focus on value and outcomes-based models. We will also partner with the federal government in this work. The U.S. Department of Health and Human Services and the Centers for Medicare and Medicaid Services recently announced the launch of a new cell and gene therapy access model. HFS has already submitted our letter of intent to join this program, leveraging a multi-state bargaining approach. And just last week, federal CMS approved our Medicaid state plan amendment, allowing us to enter into outcomes-based agreements with drug manufacturers to negotiate additional state rebates for high-investment drugs and therapies. For our customers, Medicaid is healthcare coverage. It provides access to preventive services and to care when they are sick. On the back end, for those of us working to administer this vitally important program, it is a complicated web of rules and regulations, rates and reimbursements, all built on a traditional model of billing for services. As novel treatments that can transform lives and cure diseases continue to come on the market with high initial costs, it is our obligation to figure out how to ensure access for our Medicaid customers. The governor's action today recognizes that barriers to access must be cleared away. This is particularly crucial with a disease like sickle cell, where racial disparities have kept those barriers persistently high. My team and I are excited to dig into this work and look forward to sharing with you the solutions we develop for those we serve. Thank you. And now, I would like to introduce Dr. LaBelle.
Thank you very much. As a physician, I've been very humbled to treat and help treat patients with sickle cell disease, which is truly a devastating illness. As the director of the Pediatric Stem Cell and Cellular Therapy Program at the University of Chicago, I'm very proud to be here with the governor as he signs this executive order. It's also very poignant that we're doing this here, as the first description in the Western world of sickle cell disease was actually first described in Chicago in 1910 from a dental student who actually lived in Granada and had debilitating bone pain and debilitating pulmonary disease. And when they looked under the microscope, they saw blood cells that were crescent-shaped. And that was the first description of sickle cell disease. So it's quite poignant that we're doing this here. I think I can't understate the transformative therapy, not only for sickle cell disease, but the transformative therapy that this represents for children with all different kinds of diseases, right? This is the tip of the iceberg. And to put it into context for patients with sickle cell disease, the average life expectancy in the United States with someone with sickle cell disease is 20 years less than the average person without sickle cell disease. It's unacceptable. And while the molecular mechanisms of sickle cell disease were understood many years ago, it's only now that we have a transformative therapy, lifelong therapy for patients with this disease. And it is an exciting time. It is a time filled with energy with patients with sickle cell disease, because for the first time ever, every single patient with sickle cell disease has options for lifelong cure. That is exciting. And I can't understate the impact that that has on the patients that we see, the children that we see as they grow through adolescence and then they become adults. Care for patients with sickle cell disease takes a team. I work with a wonderful, comprehensive team of physicians. One of those physicians is here. It's Dr. Radhika Pedinti, who is the director of our sickle cell program at the University of Chicago in La Rabida. I'd like to introduce her now.
Good morning. Thanks, Dr. LaBelle, and thank you for everybody and Dr. Pritzker for being, Governor Pritzker for being here. I am the director for the sickle cell program at the University of Chicago and at La Rabida Children's Hospital. And we've heard from people all morning, and I can attest to the fact that sickle cell disease is a chronic illness. It can take a physical and emotional toll, not just on the patients, but the caregivers. the sheer unpredictability of how crises come through in these patients. They cannot plan their life. They cannot plan the next week. They cannot plan homecoming. They cannot plan graduations. And it really takes a toll on patients and caregivers. It's very important in terms of early diagnosis, and then you need comprehensive treatment of these patients. So patients with sickle cell come to us right after newborn screening. So the disease is diagnosed on newborn screening, they come to us, and we take care of them through adolescence, through the 20s, through the 30s. We follow patients here in this program till 25 years of age. And one of the things that happens with these patients is we want them to have a complete, full quality of life, a productive life, and really be able to live life to the fullest. And these unpredictable crises can sometimes really dampen that. As a hematologist that has been doing this for over 20 years now, in the beginning when patients would come to us, we would talk to them about, comprehensive care, we would talk to them about preventive care. We didn't have a lot of options to talk about curative or transformative care. The last 5-6 years have really brought lots of new treatments into the forefront. They have brought it to the forefront. We discuss this with the patients, but then we have to talk about access. On December 8th, when the transformative therapies, the gene therapies were FDA approved, our phones at La Rabida were ringing off the hook. Patients were calling us about, oh my gosh, there's a therapy. When can I get it? When am I able to do this? And then there were patients that were not calling us. I would see them in clinic, I would talk to them, and I would say, hey, did you guys hear about this? On December 8th, this was approved. And they were like, yeah, we heard about it. But we also read that it costs $2 million and $3 million. I don't have that kind of money. What's the point of me asking? So they were really reticent and hesitant to ask us about therapies because they were pretty sure they couldn't afford them. So I think this is so timely and so necessary that Governor Pritzker is making these treatments more accessible to our patients with this executive order. And I'm very, very grateful for that. And to speak for our patient and caregiver perspective, I will talk to my own Akiko Jenkins and Akiko, her mom, who will come and give their remarks.
Here, put this up here. You can close your eyes. You don't even have to. Oh, you're fine. Come on. You're fine. Just say your name. Okay, what's your name? What's your name?
I'm sorry. Okay. My name is Akiko Jenkins. This is Kyoko Jenkins. She's 7 years old. Okay, so this is her speech. She's 7 years old. She likes to come to La Rabida, and the person that she speaks the most about is Chloe, phlebotomist. That's who she looks for when she actually comes, because she gives her blood draws and toys. Okay, my portion. She was, of course, diagnosed the whole 7 years ago. She was diagnosed 7 years ago with the newborn screening. And so since then, we've been here 7 years. So you heard Dr. Pedenti say that in the last 5, 6, 7 years, that's when medications have been coming out. So if she has to have sickle cell, let her have it now, with cures and everything in the forefront. Okay, as far as it's okay, baby, it's okay. So as far as the costs, I have a cousin, two cousins, but one in particular, she was excited about the therapies that came out in December, and until she found out how much they cost. So she then called it false hope. So I do appreciate the fact that, Governor,
you're signing this executive order to make it so that every or most who actually want to get this treatment can actually get it. So I'm hoping that all other states follow in this direction. Okay? All right. So next, I would like to introduce Senator Maddie Hunter. Where is she? Okay. Okay. Here.
Let's give it up again for Kyoko and Akiko. Good morning. I'm State Senator Maddie Hunter from the 3rd Legislative District here in Chicago. For too long, many residents of our state has grappled with the effects of sickle cell disease and the financial challenges associated with seeking necessary treatment. Sickle cell disease disproportionately affects underserved communities who consistently lag behind when it comes to access to comprehensive and preventative care. We've heard the statistics. Sickle cell disease occurs in 1 out of every 365 Black Americans and Hispanic Americans who face increased diagnosis. Children are especially vulnerable with limited access to prenatal care. Children can go undiagnosed until symptoms are present. Throughout my time in office, I have championed legislation to fight sickle cell through increased awareness, funding, and programs. With the help of my colleagues in the Illinois Legislative Black Caucus, we created the Sickle Cell Prevention, Care, and Treatment Program under the Illinois Department of Public Health to ramp up additional educational efforts and expand access to treatment and resources. The cost of managing sickle cell disease is staggering. We've talked about tens of thousands of dollars out of pocket for a person's, throughout a person's lifetime to cover hospitalizations, blood transfusions, and other long-term care. For those who are already struggling to make ends meet, proper care can be out of reach. In Illinois, we continue to work to make quality health care accessible and affordable through innovative solutions. I would like to thank Governor Pritzker for signing this executive order to bring both awareness to this disease and action to ensuring equitable access to treatment. By utilizing the expertise of advocates and patients, I am confident we can take a meaningful step forward towards closing the health care gap for future generations. And at this time, I'd like to bring up my friend and colleague, Assistant Majority Leader, Camille Lilly.
Thank you, Assistant Majority Leader Hunter. I'm State Representative Camille Lilly of the 78th District, and I'm honored to be here. And you're probably saying, what else needs to be said? Well, some things need to be repeated 3 times in order for the people to really understand what we're saying. But I'd like to start with, thank you, Governor Pritzker. Thank you for understanding. Thank you for listening. Thank you for being the best governor in these United States. He has been able to work with the researcher, her teams, and I want to thank you as well. Libby, thank you for bringing us the understanding and the technology and the drugs that make lives better and here in Illinois. Thank you to the doctors who care for the patients and love on them as they struggle with this disease. Thank you. And thank you for the advocates who are the voices that give us legislators the power to carry your power into the future. Thank you. Maybe give us the courage to carry your power into the future. And as you understand, sickle cell disease is a crippling disease that many live with. And we must understand collectively how important this issue is to our entire society. And as you heard, it affects the Black communities and the brown communities at a higher rate than any other communities. And it's so important that we're addressing it today in Illinois, where we're taking steps forward to improve the quality of life of those who are living and struggling with this particular illness. As you have heard, sickle cell disease is an inherent blood disorder affecting more than 100,000 people across the United States and more than 5,000 here in the state of Illinois. As you heard, Senator Hunter and I, we co-sponsored one of the pillars, which is a Health and Human Service pillar that the governor also signed into law, that addressed this particular issue of sickle cell disease. And he's now taking another step, moving healthcare access forward here in the state of Illinois, creating the equities that allows all of us to be viable citizens here in our great state. By putting forth this executive order, he is increasing services, continuing research, treatment, and basically improving the quality of life of those living with sickle cell. And actually that means saving lives. Again, sickle cell disproportionate impacts groups of people, particularly Black American. It is estimated, I will restate this, it is estimated that the sickle cell disease affects 1 in every 365 Black Americans and 1 in every 16,300 Hispanic and Latino. People with sickle cell disease have a life expectancy more than 20 years shorter than the general population. So on top of the social determinants of life, I call them social influencers, the individuals who are living with sickle cell disease life expectancies, based on zip code in many cases, are up to 30 in other diseases and health issues in our society. It could be a 30-year difference. A 30-year difference in these communities. While the cause of sickle cell disease has been known for nearly 70 years, progress has been impeded due to lack of resources dedicated to supporting research and treatment. Further, the costs managing sickle cell over lifetime has substantially estimated close to $2.1 million in healthcare expenses. And for the patient, as mentioned by Ms. Jenkins, the out-of-cost pocket is out of range, averaging $34,000 to $53,000. By the signing of this executive order, Governor Pritzker will execute an innovative and sustainable solution to financing and ensure equitable access to sickle cell disease treatment and other high-cost drugs in Illinois. Yes, he will not do it alone. This new advisory council will be formed to bring together state resources for this common goal, leveraging the expertise nationally, statewide, providers involved, sickle cell advocate coming to the table to continue the advancement of solutions and cures to sickle cell, and I think they're going to take on a few other diseases as well. Today, the patient voice and the community partners will be prioritized here in Illinois. And as we implement our ideals and the solutions that we develop, we collectively can celebrate our commitment to the Illinois residents. At this time, through the generations and generation of us working together, we can all say we are establishing the rights to health care. We are ensuring the rights to access, and we are collectively improving the quality of life. We all are. And it's because of the courage and the vision and the commitment of our governor, J.B. Pritzker. And as he comes forth to sign this executive order, and I like the way that sounds. This is an executive order. We got to get this done. I want to say thank you for your leadership and your concern for all Illinoisans. So with that, as Governor Pritzker come forth, let's give him a round of applause as he is going to sign his executive order to create quality life and equitable life for all Illinoisans. Governor Pritzker, please join us at the table.
I'm going to take a few questions before we let you all go. Thank you, Kyoko. Happy to take any questions from members of the media. Yes? Sure.
So you announced the planned demolition and rebuild of Logan and Statesville last week. I was wondering, do you have any plan for the people who are currently there and what the transit plan would be for that building?
All that's being worked out now, but obviously we would need to move people out of Stateville and people out of Logan and move them into other facilities. I should point out, I know people have said, well, how on earth could you possibly do that? Well, you may know that we have about 10,000 fewer prisoners in our correction system today than we did 5 years ago. And so it's been decompressed, I would argue. And so there is the ability for us to move people to other facilities. How that will take place, obviously, there's some complexity to it. We absolutely are keeping all of our corrections officers. We want to make sure that they stay on duty and are working with us as we make these changes, and they'll be working either at Stateville as we're building the new facility on that same site, or at another facility where prisoners would be moving to, and the same thing with Logan.
Tomorrow's election night. Any thoughts on the Bring Chicago Home referendum? What do you think that will pass?
Oh, I don't like to make any predictions. I just hope people get out to vote. I know it's an important day. I'm always afraid that people either forget that it's election day because they're not reading everything that you're putting out, or they're just busy in their lives and often too busy. But I can say you could vote today. Even if you're not registered, you can show up on election day and get a provisional ballot and register even on election day, and they'll check your registration and then count your ballot on that day. So I do want to encourage everybody to get out and vote. Yeah. Hi.
Thank you, everyone, for having us. Another kind of related question. Do you have any predictions for turnout tomorrow, and who do you think that will come?
My prediction is that members of both parties will come out and vote in their primaries. I have no predictions for tomorrow. I don't know what will happen in the elections, but I am anxious to see the results. Yes?
We're finding there's a
It's tragic. There's no doubt what occurred there, and with the prisoner who was, as you know, part of the MSR program. Actually, the notifications were made to all of the victims of the crimes that he had been convicted of. That is what's required by law. However, as you also know, that he ended up committing another crime with somebody who was not a victim of the previous set of crimes. Having said that, there's no doubt that we ought to look for better ways to communicate across the court system, across the various law enforcement agencies, and the Prisoner Review Board. But as you know, it's an independent board, and I do believe that they have the ability to make changes in the way that they communicate, and I encourage them to do that, and certainly would work with anybody that will help us to accomplish that goal.
Just to clarify, to make sure we're talking about the same thing, this was a prior victim, and she was in the process of trying to get emergency protection.
It's my understanding that the crimes for which this person was convicted, and it is a requirement that notification be made by PRB to when somebody is released, that she was not a part of that set of victims. Again, there may have been an order in place, there may have been other, but not something that the person was convicted of and put in prison for. But having said that, if I have that fact wrong, I'll correct myself and make sure to communicate to you about that. It's my understanding, though, that that was the difference between why no communication was made to that particular victim, new victim. The entire matter is tragic. There is no doubt that if it could have been prevented, that this person should have been notified in some way. The way the current system works, it doesn't require that of the PRB. Yeah. Sure. What was the first question? What inspired me? Yeah, I'm glad you asked. Thank you. So what inspired me to sign this executive order and take this action? And then we'll talk about next steps. What inspired me, I have to say, was about a year ago, I met with some folks, with other governors, actually other Democratic governors, with a presenter who talked about the coming wave of gene and cell therapies that would be expensive, but would be approved by the FDA and would be curing amazing diseases that no one ever thought actually could have a cure. And it's because of new technology that's been developed over the last 5 to 10 years. So I immediately started doing a lot of reading about what could we do to address the cost for people who otherwise could not afford it. And then I saw that the Biden administration had put an executive order in place to get the Health and Human Services Department at the federal level, along with CMS at the federal level, to start to look at what are the financing mechanisms that would allow Medicaid or people who are on Medicaid and people who otherwise couldn't afford it to be able to afford these very expensive treatments. Costs will come down over the course of years, but that shouldn't stop us from treating people as soon as humanly possible and making it as absolutely affordable as possible today. So I looked at what the president had done, I listened to what the advocates had said, and then talked to my own team about what should we be doing in the state of Illinois to make sure we're on the front edge of this. That if the president is going to, and the Health and Human Services Department are going to pick a few states to be pilots, and they're going to work with certain state departments of health, how do we become part of that group? And so I put my team to work on that, and this is part of that effort. So what's next? What's next is that we actually get some answers. Still hasn't been done fully on the federal level either. So nobody really has the answers. We're all trying to figure out, how do you finance this? And you heard somebody say that for some diseases like sickle cell, millions of dollars of cost. from the time that someone is diagnosed to throughout their life. And we're talking about $1 or $2 or $3 million up front to cure somebody. And so you can start to think about how could you finance something like that if you had a bank that was willing to finance that, if you had the right kind of backing for a loan, for example, to Medicaid, or if you could get the pharma companies to be part of that financing solution, or to lower costs if we work together, states work together to purchase these drugs, these therapies en masse, because we're all going to need it. There may be 5,000 people in Illinois, but there are thousands across, many more thousands across the country. So that's our intention here. This is the beginning of an important part of a process to end up with affordable cures for people with diseases that up to now we'd been unable to cure.
Can you take one more?
Yes. Oh, sorry, go ahead.
We usually comment on the migrants being the eviction process beginning in Chicago from the shelters, and the fact that they don't have, the majority of them don't have job permits or work permits.
Well, we should certainly talk about work permits. I think more work permits are better. I think we ought to put people to work. We have jobs available for them, and so if we could provide more work permits at the federal level, that would be great. We don't have the ability at the state level to issue work permits for people who are here from other countries. That is a Customs and Border Patrol, U.S. Department of Homeland Security responsibility. I have been relentless in talking to the department, to the White House and others about getting more work permits. As to the migrant shelter and folks who are leaving shelter, I will say that it has become a challenge that we now have some outbreaks of measles among families or young kids that have been in shelters. And so I know that the mayor is being very careful about how the city goes about making sure that people aren't just leaving shelter carrying measles, perhaps to lots of other people. And so we've been working with the city to quarantine families to help test and then quarantine families while we wait for test results, and also to make sure that we're providing vaccinations for everybody that will have one. So that's, I think, held up the process. I know everybody's anticipating, and if you take the measles issue completely aside, gee, why haven't people already moved out of shelters? The answer is there are complications that come with these kinds of challenges, these crises, and I think that the mayor's doing the right thing. But we all want to make sure that we move through this process. Hopefully we can get past this measles outbreak, and we will. But as soon as we can, and the shelter process for people moving along will continue. We're continuing to work to put people into more permanent residential situations as they move through the shelter process. At the state level, that's part of our responsibility, and we're doing as much as we can as fast as we can.
Well, actually, take one more over here.
Yeah, sure.
There's a bill in the General Assembly, HB 5766, that would prohibit changes to selective enrollment at CPS until 2027. Is that something that you're supporting?
It is. This is a bill that's sponsored by Representative Margaret Croak. It basically focuses on making sure that we don't see any changes in selective enrollment schools between now and when there's a fully elected school board. I think it would be a mistake before the people get a chance to vote all of the new members of the Board of Education in. So I'm supporting that bill. I think she's done a good job with it. Okay, thank you very much.